nature of the issue started to ring true when we started to get phone calls and almost daily emails from our colleagues in Europe.
So the day before the province shut down, I read tweets from colleagues in Milan about how their very modern, well-resourced healthcare system was being overwhelmed with COVID patients. I reached out by email to the colleagues and got some responses very early in the morning, and I wasn't sleeping, and realized very quickly that the challenge was coming our way and it was real.
So the first challenge was really to get a handle on the scope of the problem that was going to come our way. And so the two motifs actually that really drove all our decisions over the next many months was what was good for the patients and what was safe for our healthcare members.
The ministry asked us to develop a 130 COVID bed ward within a week. That more than doubled the medical missions beds. It was a huge challenge. Luckily, we crested at wave 1 at 130 COVID ward beds. So it was very heartening to see everybody come together and be creative. We developed creative solutions like using the research infrastructure, the Center for Innovative Medicine, and transforming that research infrastructure into COVID ward beds. The MGH infrastructure is an aging infrastructure and certainly was not pandemic ready. Very quickly, with technical services and infection control, we implemented changes to allow us to develop the capacity for those COVID ward beds.
All of a sudden, the ICU was thrust into the limelight. It was clear that our 55 ICU beds shared between in the ICUs of the Vic and the General would not be sufficient. You know, within 3 weeks, 4 weeks, we had effectively doubled our ICU bed capacity. But ICU beds alone without staff are really meaningless.
We didn't have COVID specialists waiting in reserve to staff 130 beds. We created a different physician staffing model whereby we had secondary attendings or pseudo-residents that helped our COVID expert staff. Dermatologists, orthopedic surgeons, cardiac surgeons, medical biochemists from all specialties contributing to help us meet that 130-bed ward challenge. To live through the COVID experience also allowed us to better dose resources. It's allowed us to become a very agile organization that I hope we'll be able to carry forward as we face new challenges.
The other thing that we did was introducing really robust infection disease protocols. Donning and duffing were terms I don't think I'd ever heard before. And they became the leitmotif of what we did in the ICU. Every time we walked into a patient's room, almost ritualistically, we would follow certain protocols in protecting ourselves.
It was very stressful for our physician groups, our nursing groups, facing the challenge of and fear of getting the illness. What a resilient group. One of the silver linings was that MUHC really became a family at the highest levels of the organization. There were family structures within the units, but we had to get units to work together to break silos, and that collaborative spirit really is what got us through the pandemic.
If there's anything that's come out of this that's at all helpful or useful, it's been that we've become closer as a team. We always were, but this really cemented that community feeling.